My name's Carolyn Broderick and I'm a sport and exercise medicine physician at the Children's Hospital at Westmead. With climate change and global warming, we're experiencing an increased frequency of extremely hot days around the world and in Australia. And this has got significant implications for exercising and playing sport in the summer months. A couple of settings in which the risk of heat-related illness is highest are those when you're exercising, when the environmental temperature is very hot, so above 35 degrees Celsius. If the humidity is high, that's another high-risk situation. Or if you're exercising for a prolonged period or doing intense exercise in lower temperatures. If the body's ability to get rid of heat is overwhelmed, body temperature rises, and this causes heat-related illness. There's a spectrum of heat-related illness, with the most mild end of the spectrum, unfortunately the most common end, being symptoms like dizziness, nausea, fatigue, weakness. And then if body temperature continues to rise, you can get more severe symptoms that affect the brain. So things like confusion, agitation, seizures, and sometimes loss of consciousness. At the severe end of the spectrum, heat-related illness is termed heat stroke. It requires urgent medical input. Sport and physical activity has so many benefits for children and adolescents, but we need to make sure it's as safe as it can be in the hot summer months. There are a number of ways in which sporting organisations can reduce or minimise the risk of heat-related illness. One is to schedule events in the cooler parts of the day. They should also provide facilities with a lot of shade, with water fountains, and if they're indoor facilities, with good ventilation. As a parent, there are a number of things you can do to minimise risk. Check the forecast, encourage your child to take fluids, and prepare some cooling strategies for the sidelines. In sports that have half-time breaks, this is a good opportunity for cooling, and some proven methods include putting children in the shade, removing any excess clothing or protective equipment, wetting the skin and putting wet towels on the skin, and ice towels around the neck. It's important for parents and sports officials to recognise the early signs of heat-related illness and begin early cooling while waiting for medical help. The best personal strategy for reducing the risk of heat-related illness is acclimatisation. This involves incremental training in the heat in those early weeks of summer. Keep you cool and stay fit and active in the summer months.